Hello everyone, in this video we are going to discuss about premenstrual syndrome commonly known as PMS. To understand PMS, let us first think about the menstrual cycle. It is a monthly biological rhythm similar to a clock, okay, that runs smoothly in most women. Every month a woman's body prepares for pregnancy through hormonal changes. Most of the time this clock works quietly. But in some women, these hormonal changes create disturbances, just like a clock that ticks too loudly or irregularly. Premenstrual syndrome refers to a group of physical, emotional, and behavioral symptoms that appear before menstruation and disappear once the period starts. While mild discomfort is common, PMS becomes a problem when it interferes with a woman's daily activities, relationships, and work performance. As nurses, understanding PMS is important because it affects a larger number of women and often goes unreported or misunderstood. Myself, Ruth Kezia, working as a lecturer in Tribulum College of Nursing. Objectives: we are going to learn about definition, epidemiology, etiology, clinical presentation, emotional symptoms, diagnostic procedure, management, to describe the medical lifestyle and complementary management options. Definition: premenstrual syndrome is defined as recurrent physical and psychological symptoms that occur during the luteal phase of the menstrual cycle and resolve with onset of menstruation. Think of the luteal phase as the waiting period, okay, waiting period after ovulation. During this time, hormone levels, especially estrogen and progesterone, change rapidly. In some women, the brain becomes extra sensitive to these changes. A severe form of PMS is called premenstrual dysphoric disorder, PMDD. Here, symptoms are so intense that they disturb social life and work, similar to how a mild headache differs from a migraine. Okay. PMDD is a severe form of PMS. Epidemiology: around 80% of the women experience at least one symptom before menstruation. 20 to 32% experience symptoms severe enough to affect daily life. 3 to 8% suffer from PMDD. This tells us PMS is not a rare condition, but its severity varies widely. Etiology or the causes. The exact cause of PMS is not fully understood, but it is multifactorial. Hormonal fluctuations. The first one is the hormonal fluctuations. Hormones act like a chemical messengers. Okay, sudden changes in the estrogen and progesterone affect brain chemicals such as serotonin. Okay, which controls this serotonin mainly controls mood, sleep, and appetite. So low serotonin leads to depression, irritability, and food cravings. Okay. The next is the progesterone sensitivity. Some women are more sensitive to progesterone, similar to how some people are lactose intolerance. Okay, they are sensitive to lactose same way. In PMS, women are sensitive to progesterone. Next is prostaglandin imbalance. Prostaglandin controls uterine contractions. So when this prostaglandin hormone is imbalanced or it is high, it can cause pain and cramps in the uterus. And next one is the stress. Sorry, stress works like fuel on the fire. Okay, it increases uterine contraction and worsens emotional symptoms. The next is the genetic and the nutritional factors, family history of depression, and possible vitamin and mineral imbalance may worsen premenstrual syndrome or PMS. We'll move on to the clinical presentation. Symptoms usually begins 5 to 14 days before menstruation. Okay, so the beginning will be 5 to 14 days before menstruation. Peak is 1 to 2 days before periods, and it disappear after menstruation begins. So the symptoms are divided into physical and emotional. So the physical symptoms are commonly abdominal bloating and cramps, breast tenderness, and headache and fatigue, back pain, muscle and joint pain, weight gain due to fluid retention, and sleep disturbances and gastrointestinal symptoms. Okay, so think of this. No, imagine the body as a water-filled sponge. Okay, water-filled sponge. The hormonal changes causes the body to retain water. Okay, so that is leading to bloating, heaviness, and discomfort. We will move on to the emotional symptoms. The emotional symptoms include depression, anxiety, anger, oversensitivity, mood swing, crying spells, less interest in sex, insomnia, poor concentration, drowsiness, concentration and memory problems, and loss of confidence. So low serotonin only causes these kind of emotional symptoms. Okay, low serotonin affects the limbic system. So limbic system means emotional center of the brain. Okay, emotional center of the brain is called limbic system. So the low serotonin affects the limbic system, causing mood instability, similar how low fuel affects engine performance, right? Same way, low serotonin affects the limbic system or the mood regulation in the brain. Okay, diagnostic procedure. There is no blood test, okay, to for finding a viral infection or a bacterial infection. You can just withdraw 2 to 3 ml of blood and send it to the lab and identify this, but no, there is no such thing like blood test for this PMS. But the diagnosis is based on symptom charting, okay, for 2 to 3 menstrual cycles and symptom occurring during the luteal phase, relief after menstruation, and symptom interfering with daily life. So I'll say it again. So the diagnosis is based on the characteristic symptoms. Symptom charting for 2 to 3 menstrual cycle, symptom occurring during luteal phase, relief after menstruation, and symptom interfering with daily life. These are the four characteristics of the symptoms a woman reports regarding PMS. According to American College of Obstetrics and Gynecology, at least one physical symptom and one emotional symptom should be there. Okay, namely in physical symptoms, we have abdominal bloating, headache, breast tenderness, and swelling of extremities. And emotional symptoms, angry spells, depression, anxiety, confusion, irritability, and social withdrawal can be there. As a nurse, you must encourage a patient to start a symptom diaries, so which is very important for diagnosing this PMS. We'll move on to the medical management. First is SSRIs. So these are the first line of drug for severe PMS and PMDD. That is premenstrual dysphoric syndrome. They increase serotonin level by thereby improving the mood. Okay. Next is oral contraceptive pills. They stabilize hormonal levels, like keeping the volume steady on a radio. Okay, so these OCPs will stabilize the hormone levels. And next is GnRH analogs are effective in treatment of PMDD. But this is used only when the other treatments are failed due to side effects because of bone loss. Okay, GnRH analogs can cause bone loss. Okay, but this is used only the other treatments are failed like SSRI and OCP is failed. We can use this GnRH analogs. The side effect for this is it causes um, bone loss. The next is diuretics. It helps reduce fluid retention and bloating. In herbal and psychologic management, Vitex agnes castus. Vitex agnes castus. It is a herbal remedy that reduces mood swings and breast tenderness. Next is cognitive behavioral therapy. This cognitive behavioral therapy helps women retain thought patterns. Imagine updating a faulty software in a computer. So same way this CBT will help the woman to retain thought patterns, okay, which are good for her mood, okay. So it is strongly recommended by RCOG for severe PMS. Next is dietary modification. So some of the things you have to reduce, that is caffeine, alcohol, salty foods and processed foods. Reduction of caffeine causes, reduces in anxiety, and reducing alcohol improves mood stability. Reducing salty foods decreases bloating. Reducing processed foods improves hormonal balance. A good fuel will support a good engine, right? Same way, a healthy diet supports good hormonal regulation. Next is exercise therapy. Exercise is the first line non-pharmacological treatment. Scientific basis, it increases endorphins, that is natural painkiller. It reduces estrogen and progesterone levels. It improves blood circulation and it reduces stress and depression. Aerobic exercise improves fatigue, mood and concentration. Swimming therapy. Swimming reduces body weight stress. So swimming reduces body weight stress due to water buoyancy. Okay, water acts like a natural massage, calming muscles and nerves. And so the regular swimming improves circulation, reduces pain and promotes relaxation. So swimming is always recommended for women with PMS. Females were instructed to engage in swimming exercise 30 minutes daily, 3 times weekly for 3 months. So the first 3 days of menstrual cycle, it was ceased, then resumed. Okay, so there are three stages like warming up, swimming, cooling down. So warming up phases had a breathing, circulation, circulatory and stretching exercise. In second phase is 20 minutes swimming, and in the last phase cooling down. Okay, so this is how the swimming exercise was started in women, 30 minutes daily, 3 times weekly for 3 months. Myofascial release technique next. So this myofascial release technique, to understand this, you should know the anatomy of our body. If you take the chest and abdomen, the layers of the abdomen is arranged like from skin. You have skin, then subcutaneous fat, then fascia, then muscles, then you have peritoneal layer, and then you have the viscera. That is the internal organs. Same way, if you take the extremities, we have skin, subcutaneous fat, and then the fascia, muscles, blood vessels, nerves, and bones. This is how it is arranged. So in myofascial release technique, they work on the fascia, that is the layer above the muscle. Imagine fascia like a tight clothing. Okay, once this tight clothing is loosened, it gives movement and comfort. It improves the movement and comfort. Okay, same way, this technique releases the tight fascia, improving blood flow and reducing the pain. Okay, it should be done with dry hands without lubricants or oil and creams, and 3 minutes of tension will be applied to superficial fascia and transversalis fascia and extraperitoneal fascia, followed by 3 minutes of tension applied to thoracolumbar fascia and erector spinal muscle. To wrap it up with the 3 minutes of tension applied to cervical region. Okay, so this technique known to raise the pain threshold and decreases the pain intensity. Next is yoga. Yoga is a combination of breathing, postures, and meditation. It reduces stress hormones, inflammation, and improves sleep and mood. Okay. Yoga works on both mind and body, making it an excellent complementary therapy. Next is aromatherapy. The essential oil stimulates the brain to release dopamine and serotonin. So this is the scientific explanation behind. Aromatherapy was effective to improve both physical and emotional symptoms associated with PMS. Lavender and rose oils are especially effective in reducing anxiety and mood swings. Next is acupuncture and acupressure. These methods stimulates energy points to reduce pain and stress. Evidence is limited, but many women report symptom relief. Okay. Next is kinesio tapping. Taping improves blood flow and reduces muscle tension in the pelvic region, and it helps relieve pain. Okay, so basically taping will improve blood flow, reduces muscle tension, and helps to relieve pain. Technique is there are two tapes basically. Okay, so if you take the sacral bone, it is like a wedge shaped or a bone. Okay, it will be a V shaped bone if you see at the back. So on both sides the tape will be fixed. Okay, like a V shaped, and the base will be attached together. Okay, and and the other end of the tape will be pointing upwards and obliquely. Okay, so this is how the taping technique works. Next is heat therapy. Heat increases blood circulation and relaxes muscles, and it reduces pain and autonomic imbalance. Conclusion: premenstrual syndrome is a common yet manageable condition affecting many women. Understanding its causes, symptoms, and treatment options allows nurses to provide holistic and compassionate care. A combination of medical treatment, lifestyle modification, exercise, and complementary therapies gives the best results. As future nurses, your role in education, early identification, and support is vital in improving women's quality of life. I hope you gain some knowledge about premenstrual syndrome and how to care for a woman with premenstrual syndrome. Thank you all.